Now, this is a segment that is both for the men out there and the women. I want everyone to listen up because I think it's something that men are sometimes uncomfortable talking about. Joining me to discuss prostate cancer is Dr. Gary Kirsh. He is the president of the Urology Group. Dr. Kirsh, thanks so much for joining us for Simply Medicine today.
Well, it's a great pleasure. Thank you.
Do you believe that there's some sort of stigma or a reluctance to discuss prostate cancer?
Well, yes, there is. First of all, with men, there's a stigma to discuss a lot of health issues. Many men prefer to put their heads in the sand, not all. With respect to prostate cancer itself, it's a sensitive subject, right? Because it deals with uh, male reproductive system, which is always a sensitive subject. And the exam to check for prostate cancer, which we may get into in the course of this interview, has to do with inserting a finger into the rectum and feeling the prostate, called the digital rectal exam. And this is also something that men sometimes are reluctant to undergo.
Too, but explain to the men and the women out there why it's necessary to check the prostate that way.
Although it is uncomfortable and not something that you would look forward to, it's not terrible. I mean, it's brief. Takes 15, 20 seconds. There's some pressure. It's not something you look forward to, but it's certainly tolerable. So I don't want people to come away with the idea that it's so devastating to have the exam. And why do we need to do the exam? We need to do the exam because there's two ways that we can try to detect prostate cancer early. One is with a blood test that I'm sure we'll come to in the course of this interview, called the PSA. But what a lot of people don't realize, even many physicians, that the PSA could miss maybe even up to 20% of prostate cancers that can be found by feeling the consistency of the prostate with the finger and looking very much, if you think of it, how women are taught to examine their breasts and make sure they don't feel a lump. Well, we need to make sure we don't feel a lump in the prostate. And sometimes the lump can be felt but not picked up with the blood test.
So would the lump would actually be sizable enough that you would feel it with that rectal exam?
Well, that's right. Now, it may not be, in some cases, it may not be sizable enough, but in some cases it is. And I can attest to having found prostate cancer in men who have a normal PSA blood test level and who I felt on exam had an irregularity or a lump. And we went and checked that and we did find cancer. So yes.
So PSA, what does that stand for?
PSA stands for prostate specific antigen. It's a mouthful. The PSA is a chemical that in of itself has nothing to do with cancer. The function of this chemical made by the prostate in a healthy man has to do with semen function. Why is it correlated with cancer? It was discovered in the 1980s that normal cells do not leak as much of this PSA chemical into the blood as cancer cells for whatever reason. So the more cancer cells there are in the prostate, typically the more PSA will leak into the blood and be detected on the blood test. So there is a correlation to having cancer with a higher PSA, although it's not a perfect correlation.
How often should men undergo both the PSA test and the rectal exam?
Well, I think yearly, maybe every other year. It depends a little bit on the situation. If a man at the age of 50 who has no family history risk, perhaps not African American, the African American population has a higher risk profile. No family history, as I said, very low PSA. Let's say the PSA was 1 or something under 1, normal digital rectal exam, might not need to be checked for a couple of years. On the other hand, those with a family history, African American descent, a little bit of a higher PSA at baseline, they should probably be checked yearly.
Is prostate cancer easy to treat if caught early?
Most of the time when caught early, it can be treated and cured. In fact, when it's caught early, the cure rate can be as much as 90%. There are, unfortunately, certain men who do everything they're supposed to, get checked every year, get the rectal exam, get the blood test, and lo and behold, here comes prostate cancer that's uncurable. It's rare, but it can happen. So I think the message is nothing's perfect, but if we do the right thing by getting checked, we have a very good chance of catching it early and having it cured.
We're here with Dr. Gary Kirsh. He is the president of the Urology Group in Norwood. Some men just may be reluctant. I've heard of people who don't go to the doctor for years at a time for their physicals and, just that blood work annually to see if, there's anything strange going on. And I mean, I get it. People are busy. Sometimes going to the doctor, it's not always that pleasant. The anticipation's worse than, when you get in there and it's fine, whatever. But some people just don't want to go to the doctor.
Oh, I know. And basically, what do you say to that? I mean, if a person doesn't go to the doctor, they're rolling the dice. Now, when you roll the dice, many times you win. People can say, look, I never went to the doctor. I'm 80 years old. I'm fine. And there's no question that can happen, right? You rolled the dice. But some people, when they roll the dice, they come up with craps and they lose. And so the question is, do you want to be proactive about your health? Do you want to make sure that you're doing okay, have your blood pressure checked, have your cholesterol checked, have your PSA checked if you're a man, women, mammography, the whole thing with preventative health is very important. Now, we don't want to go overboard as physicians. We don't want to order unnecessary tests. We don't want to perform unnecessary invasive tests. So we have to use all of this with wisdom. But putting our head in the sand is not necessarily a good answer.
One thing that I thought you said was interesting is that it's one of the top causes of death in older men. I remember when my grandfather had prostate cancer. He was 91. And I remember somebody saying, basically, if men live long enough, they're going to get prostate cancer. Is that true?
No, that's actually not true. Some of the studies that led to that kind of thinking were based on autopsy studies, people who had died and they looked at their prostate of some dead men and they found a few cells and they would say, well, when we take all these older men and do autopsy studies, we see a few cancer cells in a great majority. But clinically speaking, clinically evident prostate cancer, where it would be diagnosed because something came up in your lifetime, this does not happen to every man. It happens to about 1 in 8 or 1 in 10 men.
So at what age should men start undergoing the PSA testing and the rectal exam?
We usually say at age 45 for African Americans and age 50, or for those with a family history of prostate cancer. And for those who don't have those risk factors, age 50, 45 with a family history of African American, age 50 for others. And if you have time, I don't want to keep speaking too much, but I would like to address some of the new things that we're learning about family history also.
Well, tell us about that.
Well, thank you. And the reason I mention that is when we talk about family history, we're learning some new things about prostate cancer and its link to other cancers. So if a man has no family history, let's say you have a 55-year-old gentleman, no family history of prostate cancer, but if they've had sisters, a mother, an aunt who's had breast cancer, or if they've had other relatives with pancreatic or colon or ovarian cancer, they may be at more risk of prostate cancer. And the converse is really important. If you have a man who has prostate cancer, let's say the man is in his 60s and has a dangerous prostate cancer, we no longer need to just worry about that man's son's risk of prostate cancer. We now need to worry about that man's daughters and their risk of breast or ovarian cancer, because we're finding increasingly that these cancers in certain people are linked through the BRCA gene and other things that have been typically associated with breast cancer historically are now also associated with prostate. So we need to look at all of these cancers in the family history.
That's very interesting. So is it possible that in women who have a history of breast cancer, would the men in their family then be at risk or higher risk for prostate cancer?
They might be, yes. Particularly any woman who has the BRCA gene. Some of your listeners may be familiar with the BRCA gene, very dangerous gene for women due to the very high lifetime risk of breast and ovarian cancer and other cancers. Men, their sons are at risk for prostate cancer.
And I think the BRCA gene is the one, and I don't want to misstate anything. But if I recall, I think I read articles about this a few years back where women were undergoing voluntary mastectomies before they were diagnosed because they carried that gene. I think Angelina Jolie did
That is
something with
correct.
that.
That
Okay.
is correct. Women will often undergo preventative mastectomy because the risk of breast cancer is so high. It's a relatively small group, but when you have families that have a lot of breast cancer in the family, there are a lot of families like that. The men may be at more risk for prostate cancer as well.
So if men have the BRCA gene, is there anything you can do to prevent it? Because you're not going to just go and get your prostate removed.
No, the only thing you can do if men have a BRCA gene is just monitor them much more closely for prostate and frankly for some other cancers as well.
And now I'm going to ask you a question that may make some people uncomfortable, but I'm going to ask it anyway. Does having prostate cancer and undergoing treatment that will eradicate that cancer leave you impotent?
It certainly can. And that's a well-known side effect of prostate cancer treatment. But no matter how bad the erectile dysfunction is, we can fix it. It just is a question of what hoops does the man want to jump through?
That was Dr. Gary Kirsh, the president of the Urology Group in Norwood. Coming up next, we are going to talk with a man who survived COVID-19. His doctors didn't think he would make it. You're likely going to recognize both his name and his voice. That's ahead on Simply Medicine here on 55 KRC, the talk station.